Federal Health Minister Mark Holland has paused the work of the Canadian Task Force on Preventative Healthcare, which has faced criticism for not lowering the recommended breast cancer screening age to 40. The task force has faced criticism from medical professionals for its outdated screening guidelines. I was joined earlier by Dr. Abhishek Raut, medical director at Appletree Medical Group, to discuss the work of the task force and the role it plays in Canadian healthcare policy.
The Canadian Task Force on Preventative Healthcare actually plays a pretty pivotal role in shaping health and well-being for us. This is an independent, federally appointed body, and it's responsible for developing evidence-based guidelines for preventative healthcare. So their work really focuses on screening, early detection, interventions for a few different health conditions, but more importantly, including cancer, mental health issues, and chronic diseases. So the task force's recommendations is really designed to guide primary healthcare providers such as myself across Canada. So that ensures that preventative measures are really effective and also aligned with the latest scientific evidence. So what we know is their guidelines on breast cancer screening have been a topic of significant discussion. So while they recommend the routine mammograms for aged 50 to 74, there's a lot of criticism for not lowering that starting age to 40 despite rising breast cancer rates in younger populations. So what we do see, though, is this influence of the Canadian Task Force really extends beyond just individual healthcare decisions. It helps set national standards. The task force impacts public health policies, and that means it impacts funding allocations and even the design of provincial health programs. Some provinces, like Ontario and British Columbia, have changed and chosen to fund mammograms for women aged 40 to 49. So that's a divergence from what the task force's typical guidelines recommend. So there's still certainly a lot of controversy with regards to the task force, but it still plays a very pivotal and influential role both for an individual and systemic health outcomes.
We also asked why the Canadian Task Force is now lowering the recommended breast screening age despite the growing criticism they faced.
Very good question. The Canadian Task Force on Preventive Healthcare maintained this recommendation they had on breast cancer screening age 50. And like I mentioned, there's significant criticism on this. And they wanted to maintain that because of concerns of potential harms for early screening. So these harms, we don't really talk about harms too often with screenings, but there are harms that can come from it. These harms include false positives, which can lead to a lot of unnecessary and painful biopsies, as well as overdiagnosis. So overdiagnosis means we detect cancers that may have never caused harm if left untreated. So now these outcomes can create a lot of emotional distress for patients and place a lot of additional strain on the healthcare system. So what the task force did was they emphasized the importance of shared decision making for women aged 40 to 49, and they suggested that women of this age group should consult with their healthcare providers and really weigh the benefits and the risks of early screening and decide whether to proceed. This approach has been criticized because there is concern about the rising rates of breast cancer in young populations. And certainly we've got groups such as the Breast Cancer Canada has argued that these guidelines don't necessarily reflect the most latest scientific evidence for this as well.
We also asked Dr. Raut about what the best evidence available says about lowering the screening age from 50 to 40.
The experts on the other side are really advocating a lowering breast cancer screening from age 50 to age 40. And there's a growing body of evidence that shows that this early detection saves lives. So breast cancer is one of those very common cancers which affects women globally. And what we are seeing is younger women are increasingly being diagnosed with the disease. So in Canada, for example, breast cancer affects 1 in 8 women during their lifetime. And what we see is this early detection will likely significantly improve those survival rates. Now, the push to lower the screening comes from the data that suggests that cancers detected with women in their 40s can oftentimes be more aggressive. So by starting those routine mammograms earlier, healthcare providers can identify these tumors that can be very aggressive at an earlier stage when treatment is much more effective and less invasive. In Ontario, the government's already lowered that self-referral age for mammograms to 40. And the estimate is that this change can connect an additional 300,000 women to life-saving screenings. I think their concern about keeping it at age 50 has been unnecessary suffering and deaths as a result for cancers not being detected until it's too late. And the big criticism here is there's a lot of modern literature talking about modernizing healthcare guidelines to ensure they really align with this new body of evidence to push screenings towards 40.
And we discussed what should happen next regarding the task force and the need for reviewing guidelines more frequently.
I think when we look at any task force guidelines, if it's the Canadian task force or the US preventative task force, we've got to look at every single guideline and make sure the body of evidence is reflective. Now, in today's day and age, we see that evidence changing very quickly. So it's very important to have those guidelines reviewed very frequently as well. There's a lot of preventative measures beyond breast cancer screening that we should be looking at. Firstly, we should look at cervical cancer screening. So current guidelines have relied on the Pap smear at set intervals, but really there's been a lot of advances in HPV testing. And what we want to do is have a more targeted approach, potentially even longer intervals between screenings, but better screening mechanisms as well. Another one is prostate cancer screening. The use of PSA has really been debated for a very, very long time because its propensity for overdiagnosis and consequent overtreatment, which we've mentioned before. And in Canada, the National Health Guidelines emphasize balancing these benefits and potential harms. But we do have experts that recommend that the PSA should be re-examined and really looked at from new data and whether it's going to be a part of modern screening or not. Finally, I think mental health screenings should come under a lot more scrutiny. Our understanding of conditions like depression and anxiety has definitely changed quite a bit, even in the past 5 years. And the current recommendations for routine mental health screenings would need some updating. I think we really should look at screenings for children as well. And certainly looking at the global literature and the global data suggests that we do need to be much more proactive in mental health screening in general.